Welcome, everyone. Thanks for chiming in. So today we're going to go over some breathing exercises that we utilize in our office. And so there's a lot of information out there about proper breathing. And really the gist of it is we're intended to breathe through our nose, not through our mouth. And so normal breathing is through the nose. And so my team member here, Crystal, who is trained in myofunctional therapy and Buteyko breathing, is going to go over those exercises with us today. But really the gist of what I tell patients every day is the nose helps to warm, moisten, and filter the air we breathe. And a lot of times we overbreathe and we breathe from our chest rather than our diaphragm, and we're breathing through our mouth. And so that will cause us to breathe in cold, dry, dirty air rather than warm, moistened, and filtered air. And so a new book that came out that is really great is Breath by James Nestor. Really good book, a lot of great information, and talks about the importance of breathing from a historical perspective, and just good reading for anyone who's interested in learning more about the importance of it and the value of it. So, but without further ado, I am actually going to be the patient today, and Crystal is going to be taking me through some exercises. But before we start, I'm going to have Crystal introduce herself, a little bit about her background, her training, and then the types of patients she sees and the types of patients that excel with seeing her here at our office. She takes referrals from orthodontists and other medical practitioners as well, and sees a lot of our patients here at the office. So, Crystal, I'll let you take it away, and I will follow your lead.
All right. Well, welcome everyone. Like he said, my name is Crystal, and I do the myofunctional therapy here, as well as some breathing retraining with a lot of our patients. The exercises that I most frequently do are to decrease nasal congestion and help people breathe better through the nose, as we want to breathe better through there. The training that I've gone to is for myofunctional therapy. I've done some certification through the IAOM. I've done a certification through MyoBrace, and just kind of excelled in those programs, as well as done some Buteyko breathing course with Patrick McEwen, who taught Dr. Lauer and I a lot about the Buteyko technique, which comes from Dr. Buteyko himself, and he's a Ukrainian. So, and that's who Patrick actually studied with. So we feel like we learn from the best. So basically our patients that we see here, a lot of mouth breathing, teeth not exactly where they would like to be, and tongue position not in the right place, which is usually caused by some kind of nasal congestion or obstruction. So we like to get to the bottom of what's going on first, and then we retrain breathing as long as we're addressing the stimulus as what's causing the congestion or the obstruction to begin with. So I would say the biggest thing that we do here is decongest noses. We talk about, what could be causing that as far as environmental and diet, and then also just get the lip closure corrected with some myofunctional therapy exercises so that their nasal breathing is actually benefiting them. And benefiting their jaw joints and their sleep and their teeth position and everything that goes into what breathing affects. So,
and a question we'll commonly get is, do I need nasal surgery, or should I just go right to an ENT? And you talk to any ENT, they don't want to just see patients for nasal congestion. They obviously will, but some conservative first line things should always be attempted and tried if someone reports not being able to breathe through the nose. We can give some simple techniques that we'll go over today just to determine if someone has such a big physical obstruction that they can't get air through. There's some pretty basic exercises that we should be able to do without adding stress, and being able to, little easy thing is keep your lips closed for 10 minutes. If a patient can't do it for a couple minutes or can't do it long enough to sustain normal breathing, then we got to look into that to see, okay, is there physical obstruction? Are there severe allergies and stuff like that? So all of this is always done under the direct evaluation with a medical provider to make sure that it's safe and healthy for the patient. So take that into consideration as we go over some of these exercises. But really, we want it to be a tool for people to understand what's out there, what it looks like and feels like, because a lot of people will hear terms like breathing retraining or breathing exercises, and they have no context to associate that with. So we'll start off with some basic information about the exercises, and then I will be the patient.
Yeah. Okay. So we're going to do the first exercise we're going to start with is called a control pause. This is the basic measurement of Buteyko breathing. It allows us to see how comfortable you are breathing in general. So it's a pretty easy, quick measurement. You only have to do it once a day. The most ideal time to do it is in the morning before you have any breakfast or anything like that. So there's nothing sitting in the diaphragm, so that you're getting the most consistency of that number. The ideal way that you go through Buteyko breathing is that that number increases. And if that number increases, then your symptoms usually decrease. And when we talk about symptoms, we're talking about wheezing, coughing, asthma type symptoms, and anxiety and things like that. So we'll walk through a bunch of exercises, but this is kind of the key measurement that they use to determine whether you're getting success with the breathing technique, if you're practicing it enough, if you need to practice it more. And if that number is getting better and improving, then that means that you're having some success with the breathing retraining. So we're going to start with that first. So I'm going to stand over here and I'm going to walk him through all the exercises, and I'll come introduce every exercise so that you can focus on Dr. Clower as he's doing this. So we want you to set up nice and straight. Posture is extremely important when we're talking about breathing. We don't want anything obstructing that diaphragm from being able to expand as well as it can and as naturally as it can. This exercise is not meant to make you out of breath whatsoever. So again, it's the how comfortable are you with your breaths. So this exercise I'll explain first, and then we'll have Dr. Clower do it. So with this exercise, you breathe in a breath in through the nose normally and a breath out through the nose, and you pinch your nose and you count how many seconds that your nose that you can hold your breath comfortably. The very second that you feel like you need to breathe, you stop plugging the nose, you breathe in through the nose, but that's how long your control pause is. The easiest way now, all of us have cell phones. You get out a cell phone, you click the timer to start it, and then that's how you're able to figure out how long your control pause is.
All right, get the timer out.
All right. So
hope I pass.
Now, ideally, obviously, we don't want to do this at the end of the day, but we're doing it at the end of the day because that's what timer.
So do as we say, not as we do.
Yes, exactly. So do it first thing in the morning. All right. So I'm going to have you go ahead and whenever you're ready, sit up nice and straight. I'm going to have you take a normal breath in through your nose, a normal breath out through your nose. Pinch your nose whenever the breath is out, and hold your breath for as long as you feel comfortable. So what you're looking for is the very first instinct to breathe. So that could be an involuntary muscle movement. That could just be like your brain saying, okay, I'm ready to take a breath. Whatever that is how long your control pause is. Ideally, you should not be out of breath, and your breath shouldn't be different from what it was prior to you doing the control pause. Okay, so Dr. Howard actually did pretty good. His control pause is a 32. What a 32 means, anything less than 10, your breathing is super heavy, very erratic, very irregular, and so it's out of control, basically. It's hyperventilation. So when we get to more like 20 seconds, it's less noisy, it's more controlled, and you start to get a natural pause. So the natural pause that you should get while you're breathing is you breathe in, you breathe out. At the bottom of that breath, once the breath is out, there should be a natural pause before like you need to breathe again. So that's at 20 seconds. At 30 seconds, which is where Dr. Clower is, you really start to define that natural pause. So that the natural pause becomes very much longer, and it's very apparent. Whereas the 20 seconds, it's a quick natural pause and then another breath in. Dr. Clower actually if he did it correctly. And you do it every morning, so you'll know if you're doing it wrong or not, because that you shouldn't get very extreme differences in that number. Where he's at, definitely he's got that larger pause, natural pause. Now the goal would be to get more to like 40 seconds. So 40 seconds is where your breath is very calm, very unnoticeable. You don't hear it at all. So that's really what the goal would be. So he doesn't have too far to go to get to his goal, or the ultimate goal of Buteyko. So that was good.
And what the pause is important for is, if you look up the Bohr effect of oxygen and carbon dioxide, is we have to have a balance between the two. So actually breathing more and breathing heavier expels out too much CO2, and then we're not able to utilize the oxygen that we breathe in. The CO2 is what carries the affinity for the oxygen that gets out to our tissues. So breathing steady and slow actually garners more oxygen to our body. Also, it allows our air to reach lower in the lungs where there's more blood flow, utilizing that oxygen better as well. So the kind of the method behind the madness of slowing down the breath is actually perfusing the tissue more with oxygen, and not having those, or having those carbon dioxide and oxygen levels be more in balance. And so that's why just an oxygen mask with heavy breaths is not what we want to do. We want to have those slow, steady, sustained breaths.
I think something that people get confused about too is the control pause. They're like, oh, I need to increase it. I'm just going to hold my breath longer. That's a whole different exercise.
Yeah.
And the goal with all of these exercises is that naturally your natural breath hold becomes longer because it's natural. We don't want an extended hold. That's not considered a control pause anyways. So to increase the control pause, you're not actually doing anything with that exercise to increase it. You're doing all the other exercises to increase it. So not to get confused with breath holds in general.
Yeah, and the sensation that you'll feel, you shouldn't have to think about holding your breath. It should just kind of be sustained, and the first inclination to take a breath, that's kind of your controlled pause. So it's a controlled fashion. We shouldn't be forced to it. And as Crystal said, right as you start to breathe back in, if you find yourself going and having to do like a catch-up breath, then you held it too long.
Mm-hmm. And so I would redo it at that point and get something more natural. And a lot of times the actual breath hold, or the controlled pause, the first initial like reaction to breathe is sometimes an involuntary muscle movement here or even in your neck. So if you feel something kind of twinge in your abdomen or your neck area, that is that initial breath muscle reaction, and that's the end of your control pause. So the first time I did the class, I wasn't sure what I was looking for, but you feel
sometimes when we're doing it on patients, we'll see that little flex in the neck, and you kind of see the muscle spasm a little bit. So
perfect. So so not a ton of work for him, but it's a lot of focus to retrain breathing. So it still takes work to get to that 40 seconds, which ideally at 40 seconds, you wouldn't also have symptoms. So we're talking about, coughing and wheezing and stress and panic attacks, and insomnia and a lot of those things that, we all, or a lot of us have, those decrease significantly when you get to that 40-second control pause. So the next exercise that I'm going to walk Dr. Clower through is very typical, one for a lot of our patients, because a lot of our patients have nasal congestion. Many of us as Americans, as we eat the American food that is so good, we have nasal congestion. So I'm going to have him practice this. And again, you'll see how it's very different from the control pause, as I'm going to have him hold his breath as long as he possibly can. So very similar position. We want to make sure you're standing up nice and straight. There is no timer on this. So a lot of people try to time the exercises. The only one that's truly timed really is the control pause. So you don't have to worry about how many seconds you're holding it unless you're trying to beat a world record. And then you can time it. So this one is going to be 6 times in a row. We're going to do the exact same thing. And in our office, sometimes I have a patient put a little tape over their lips, especially if they don't have very good lip closure, to help them get through this exercise without popping the lips open and kind of ruining what we've done so far. And sometimes I'll just have them put their finger over their lips as a reminder to keep their lips closed. If they do have good lip closure, I just continue to remind them as we're doing it. Please do not pop your lips open throughout the exercise, because we're going to do it 6 times in a row, and there is going to be 30 seconds to a minute in between each time. We don't take questions or anything like that in the 6 reps, so that we can get through it and actually feel a significant difference. If you're doing this exercise before bed, it would be great to tape the lips, do the exercise, and then just go to sleep afterwards, so that your lips stay together and you don't have to worry about mouth breathing and ruining the decongesting that you just did.
And the exercise is so easy. My 5-year-old, 6-year-old can do it. So it's just practice makes perfect. So and if you have questions as we're going along, go ahead and type them in the chat box or the Q&A box, and Crystal will be monitoring those to catch them on the fly.
Okay, so what we're going to do is I'm going to have you set up really nice and straight as always. So if you're doing this at night, sit on the edge of your bed. Don't lay down to do this exercise. So again, we want that diaphragm nice and lots of room to move. So I'm going to have you take a normal breath in through your nose, a normal breath out through your nose. I'm going to have you pinch your nose, holding your breath, and I'm going to have you sway back and forth. And this time I want you to hold your breath as long as you can. The best description I say is pretend you're at the lake and you're swimming under a huge pontoon, and you run out of breath about halfway through, and you hold it even longer because you got to get to the other side. So we want to push the limits here. We don't want you passing out, so don't push the limits that far. So keep holding the breath as long as you possibly can. The trick here is once he needs to breathe, the lips have to stay together, and he has to breathe in through the nose. So that first initial breath has to come in through the nose, so that all of the work that he just did goes into the body and not out of the body. Yep. In through the nose and out through the nose. And so now you keep the lips together. He's going to catch his breath for 30 to 60 seconds. And once the breath is caught, and I kind of look to my patient to that. I'm like, give me a thumbs up when you feel like your breath is back to normal. And again, you're catching your breath through the nose, not the mouth. So sometimes that can take a little longer for patients, especially if they have congestion. While we're waiting for you to catch your breath, Dr. Clower, I forgot to have you do this very important thing. I'm going to actually have you take a breath in through your nose and out through your nose, and try to feel how much resistance you currently have in the nose. And then when you have got that, block one nostril and feel the differences between the nostrils. So that at the end of the exercise, we do this again, and we want to know, are they feeling a difference in decongesting? Like Dr. Flower said, if there's a huge bony obstruction in the nose, we're not going to clear that up, but potentially we could clear up the congestion that's in there, which is great. So just to take a good gauge as what the right side is worse. Okay, so he's saying that with keeping his lips together. Very good. He's a good listener. So when you're ready, which I feel like you probably are. Okay, so we're going to go ahead again, and we're going to take a breath in through the nose and out through the nose. And when you're ready, pinch the nose and hold the breath and sway. You're going to keep swaying. The swaying is to distract the brain from thinking about holding the breath. You don't want to have to be forced to think about that the whole time. So really, I try to picture myself underwater when I'm doing it, that I can't come up for air for, a significant amount of time. So hold your breath as long as you possibly can. And then once again you need to breathe, that breath needs to go in through the nose and then out through the nose. The first breath goes in. And some of you will not be holding your breath as long because you can't, and that's okay. And Dr. Lauer has done this. His kids have done it, so he's practiced quite a bit. So he is good at holding his breath. I'm not as good as he is. So your nose unblocking exercise time might be much shorter than what he's doing here today. And that's okay. It's not a competition. It's only a competition with yourself. He takes his own competition very seriously. Keep your lips together, you're not allowed to talk. Okay, so we'll do again 30 to 60 seconds in between. We'll let him catch his breath, get his breathing back to normal. This would be where people have questions, right? Or is it? Okay. Just in case. You can see where this would be super difficult. So we'll do it again. Here we go. So whenever you're ready, sit up nice and straight. Take a breath in through the nose and out through the nose. And then pinch the nose and sway back and forth. You can see how this would be difficult to keep your lips together if there's someone around, or if like your lips aren't taped, or if you're not focused on it. So it's very, very easy for your lips to pop apart, even if you do have really good lip closure, because when you're out of breath, especially when working out and things like that, the first thing we want to do is like we want to take a breath in through our mouth. So keeping the lips together, I think, is the biggest challenge of this exercise, and you want to do it the whole time. And he's probably trying to beat his last time, so he's watching his clock. So he'll go 1 second more just to get himself. So again, he's going to catch his breath in through the nose, out through the nose. And remember, this is different than the control pause, so it's okay that when he stops, he's like, he should be out of breath. He just held his breath as long as he possibly could. And you ignore those muscle like twinges that tell you that you need to breathe. You ignore all of that. Obviously not to the point of passing out, but you ignore it to as long as you can possibly hold your breath. And what we're doing inside the nose is we're building up carbon dioxide. And when we breathe that in, it's significantly beneficial to the body. Are we able to get a written summarization of exercises? Yes. I guess I don't have to type back. Oh, you are getting those. Okay. So Dr. Flower right now is catching his breath. We have 3 more rounds to go. So whenever you're ready, take a normal breath in and a normal breath out, and pinch the nose and sway back and forth. I personally, when I instruct, I always say whenever you're ready, because I get like really nervous when somebody starts saying, okay, breathe in, breathe out. And I'm like, I'm not even quite there yet. So I always say whenever you're ready, because if I've explained the exercise properly, the patient gives me a thumbs up when they're actually ready. So I like to let them do their own timing rather than me telling them what to do. So I'm just a guide. So as Dr. Clara was saying, the nose is for breathing and the mouth is for eating. The nose, we're breathing in warm, moist, and filtered air, and the mouth, dry, dirty, cold air. So we want to make sure that we're using the nose for what its proper function is, and that is breathing. So this is actually helping to physiologically shrink down the tissues of the nose and allow you to get your air in better. And the less resistance you have when breathing, the better too. Like, we don't want a lot of turbulence in the airway. So that creates inflammation. So we want to make sure that when we decongest the nose that we're doing it well, so that way the air can go in fluidly and not make noise and be uninterrupted to the system. So whenever you're ready, we will do another round. Yeah, 2 more? Okay. Are you feeling a difference yet? Okay. So did you hear him clear his throat? So part of Buteyko, and when you're clearing and you're breathing properly through the nose, is your lungs start to open up and you start to clear out some stuff that is kind of deep down in there. And so it's very normal, and you get your nose starts to run, or you feel like you have to blow your nose. So it is a real thing that when you start doing this, you start clearing your throat, and you can feel the mucus start to run a little bit, which is normal. Means it's doing its job. And our patients get a sheet and it explains exactly what they're doing and they just follow right along. I had a 13-year-old today that I gave it to and she was like, yep, got it, no problem. I explained it a couple times and we did it together, but that's it. So this is a really simple exercise. I personally think it works better than my nasal spray. So are you increasing or decreasing at this point with your hold? Staying the same? Okay. A lot of people are like, oh, I should be able to hold it longer the second time. No, because the first time is going to be your longest usually, and then after that, the number can decrease. But that's okay. That's not the competition. The competition is just decreasing the congestion in the nose. So we got one more round whenever Dr. Lauer's ready, whenever he feels he's caught his breath. And you really do want to catch your breath, because if you do it too quickly, you're not holding your breath as long. You're not getting the benefits of that breath hold as much as you were if you were holding your breath longer. So you do want to make sure that you're catching your breath between, and you're not just jumping right to the next one just to get it over with, because you will lose some of the effects of it. But I would say the number one mistake people make is they pop their lips open and they do something like breathe through their mouth or they talk and then they've congested the nose again. So and if swaying like this is too much for you, like physically, you can go back and forth. You could do just like a tiny, like almost like a circle, or like, I mean, the sway is literally just a distraction. So you could tap your foot if you wanted to instead. Like you can do really anything that makes you feel comfortable. You definitely don't want to cause any physical problems. Dr. Lauer is totally holding his breath longer than what he can because he's made it. There's the 58 seconds, huh? Okay. So we got some nice hand sanitizer. So before you open your lips, because we want to know, did it work? I want you to take a normal breath in through your nose and then out through your nose. And then I do want you to plug the nostrils and see, did the one that was more blocked improve? Did they both improve? Okay, so both improved. Mm-hmm. Even though one was worse than the other, they both had improvement with decongestion. What can you tell them about the exercise or your experience doing it?
Well, it's more clear. So it's a good thing to do like before you go on a run or to bed. But especially my world is all day wearing a mask now and then also speaking. So I'm rebreathing my carbon dioxide all day. And when I mouth breathe, when I speak, I'm breathing a lot faster to keep my cadence up with speech. So by the end of the day, my nose is naturally more congested than it is at the start of the day. And so it's easy exercise that you can do in your car, on your way home, just to help decongest that nose and get it to feel more open.
Excellent. So the next exercise that we're going to do is mini breath holds. So this is like really awesome because pretty much anyone can do this exercise because you're really holding your breath for so little amount of time. It's actually used for anxiety and stress, and even asthma and constipation, I believe it's good for as well. So there's lots of good reasons to do it, but it calms people down without the commitment of this long, giant breath hold that terrifies some people. So this one is really easy. I'm going to talk Dr. Lauer through it. I'm going to have you just set your timer for I think 4 minutes is, you want to do this anywhere from 4 to 10 minutes, and you just keep repeating the same thing over. So we'll do it 4 minutes today, and Dr. Flower will be obviously the patient. So whenever you're ready, I'll have you, again, we're going to set up nice and straight. This exercise you could technically do walking around the room too, if that made you feel less, anxious as well. So whatever makes you feel better, but we'll do it sitting today so it's easier for you to see Dr. Flower doing it. So I'm going to have you take a normal breath in through your nose, a normal breath out through the nose. You're going to pinch your nose, and you're going to hold the breath for 5 seconds. So 1, 2, 3, 4, 5. Release, and you're going to breathe normally for 10 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You're going to take a breath in and take a breath out and pinch the nose. And 1, 2, 3, 4, 5, and release. And then breathe in and out through the nose. Again, we're keeping our lips together. If you can keep repeating that, Dr. Flower, while I explain. We're keeping the lips together. We're breathing through the nose. If 5 seconds makes you feel anxious, then do 3 seconds. So, the whole point of this is to help with anxiety. We don't want to create anxiety if 5 seconds feels a little bit too long for you. And people that have a control pause of 10 seconds, 5 seconds does feel like a lot to them. So don't feel don't make yourself uncomfortable with this exercise if 5 seconds is too much. So continuing to do that with 10 seconds in between, 5 seconds or 3 seconds if that's more comfortable for you. And usually the people that are holding the breath for 5 seconds can go for 10 minutes doing this. People that can only hold their breath for 3 seconds are probably going more at the 4 minutes with it, and that's okay too. So we don't want to create any issues with it as well. So keep going. So breathing for 10 seconds. Yep. 4, 5, and then release and breathe normally. And again, the goal is we keep our lips together. We're using our nose for what it's supposed to be functioning as, the breathing and the filter of our body. And it allows everything to kind of calm down. So we're almost 2 minutes in. So he'll do it for another 2 minutes. I tried this exercise actually when I was in triage having contractions for my baby, because I just had my first little girl, well, our first baby at all, but our little girl almost 10 weeks ago. So breath holds, I was trying everything. And the breathing they teach you when you're doing that is completely different than the breathing that we teach. So it was hard to listen to what they were doing. They said I was the best nasal breather that they had ever seen while giving birth. So I guess that's good. It was opposite of what they advised, but I was like, it's hard for me to breathe through my mouth. I feel lightheaded. My husband was like, good luck getting her to breathe through her mouth through this whole thing. So we'll do another minute. So he's going to just do 5 seconds holding and then 10 seconds release. And you just breathe normally. Usually with a 5 second breath hold, unless you do only have like a 10-second control pause, you're not typically out of breath. The point isn't to get you out of breath. It's just to pause your breathing so that you're slowing down your breathing momentarily. So it's not necessarily to have you, breathing hard or getting out of breath or anything like the nose unblocking does. This next exercise we're going to go over definitely is a big challenge and gets you really focused more on the breath and breathing at the diaphragm. So he's going to do probably just one more, and then we'll breathe for 10 seconds. Good. So they say like if somebody is having is hyperventilating, it's a good exercise for them to do, or somebody that's really having almost having an anxiety attack. because their breathing is so out of control. Their control pause at that moment is definitely less than 10 seconds, and they have no control over what they're doing. So even just to get them to pause for 5 seconds with their breathing can significantly decrease the rate of their breathing, which can really calm things down for the body.
And if you know, look at history, all parents and teachers are practicing this when a child falls, scrapes their knee, becomes agitated, excited, crying, etc. We've historically told kids, close your mouth, breathe through your nose, calm down, because breathing through the nose does calm you down. And so it's nothing new. These techniques are nothing new. It's just stuff that's been rediscovered, and we're kind of getting back to how we should be with breathing through the nose.
Mm-hmm. Okay, so the next exercises all focus around the same theme. So it's all about reduced breathing, and we're gonna do it in a couple different ways. Dr. Flower's gonna demonstrate, just one where we're putting our hand on our tummy and our chest, one where we're actually cupping our hand over our face, and then where we actually block a nostril. And this helps to really get you aware and focused on your breath and how crazy your breath might be. I remember when I did this course, like the cupping really made me focus, and I was like, holy moly, I am breathing way harder and way faster and way more than I really thought I was. So this exercise is great. If you really have no clue how you breathe, this is a great one to really find out how you actually are breathing. So the first thing we're going to talk about again is posture. We want to make sure that we're sitting super upright, very straight. We want to bring awareness to our breath as we go through it. So I'm going to be I'm going to be talking him through it and giving him kind of some ideas of how to focus more on the breath, and then also how to slow it down. So once we figure out where our breath is and how crazy it is, how do we manipulate it? How do we change it? And how do we improve it with the exercise as we're doing the exercise? And then to create a tolerable air hunger. So like Dr. Flower is good at breath holds, so he's going to be able to find a pretty good tolerable air hunger. Like I said before, we don't want you passing out, but we definitely want you to feel like you're not getting enough air in while we're doing this exercise. That's the point. And then, so we're going to go ahead and get started. So I'm going to have you set up nice and straight. Pretend that there is a string pulling you from the top of your head all the way up towards the ceiling. And then I want you to lengthen the distance between your sternum and your navel. I want you to widen the distance between your ribs. And this first one is I'm just going to have you put your hand on your chest and one on your tummy. And I'm going to have you focus on that breath. Where's the breath coming from? So I want you to breathe normally. Is the breath going all the way down to the lower hand, or is it stopping up at the top one? I just want you to bring awareness to the breath. Is it fast or is it slow? Can you feel the air coming in through the nose, cold, and when it goes out, slightly warmer? I want you to feel that air going through your nose hairs. We're going to focus on this for just a few minutes. I'm actually going to or if you can set your timer real quick. We're going to do this one we're going to do each for 4 minutes. So I'm going to hit start. So this one, I want you to keep focusing on that breath coming in and out, going all the way down to that diaphragm. So get it all the way down to the lower hand. And start to slow down the rate of your breathing. Really focus on slowing down the breath as it's coming in and slowing it down as it's going out. When the breath is going out, there shouldn't be any effort in it. So a lot of people, push the breath out. What I want is you to breathe in very naturally and slowly, and then let the breath fall out. And there should be a natural pause at the bottom of the breath before you take another breath in. So you should start to feel a little bit of air hunger. If you're slowing the breath more than what you're used to, you should start to feel the air coming in slower, and you should feel like you need or want more air to come in. Feeling a sense of breathlessness is normal. And the breath out, I want you to relax. Let your body relax. Let your mind relax. Don't let your mind wander. So if you're thinking about what you're doing after this, your grocery list, where you have to take the kids, I want you to come back to the breath and focus on just thinking about the breath. So the breath should be light. It should not be noisy. We just did the decongesting, so that should help the breath. And I like to do what Dr. Clower's doing right now. I like to close my eyes when I'm thinking about my breath work, because when I'm like looking around, if like someone's looking at me or I see something, it's very easy to get distracted when you're doing this because you're kind of sitting in silence, and we don't do that enough in the world. So make sure that you're taking the time to do this in a quiet environment where you can really focus on that air coming in and out, and you can really manipulate it and slow it down and change the direction of how you're breathing. So again, make sure that there's a string pulling you straight up. You're sitting up nice and tall. And that you're lengthening that distance between your sternum and your navel. And you're widening the distance between your ribs. And your breath is coming all the way down to that lower hand, down to the diaphragm. You're feeling cold air as it goes into the nose, and warm air as it comes back out. I want you to think about taking in less air than what you were taking in before. If this exercise is too much for you and you are already reduced your breathing to like the most that you could, and at this point you're like, I feel like I'm gonna need to take a big breath, that's okay. Take a breath, get back to it. I mean, we had to do that in class. We were not experts at it, so don't feel like, oh my gosh, like I can't reduce it anymore. It's okay if you need to take a catch-up breath. But as you start to practice and focus more on Buteyko, you shouldn't need to do that as much or at all, because you're going to be used to actually breathing slower and slowing down that breath. Great. So we did this one for 4 minutes. Dr. Clower, can you explain how does this help you? How does the hand on the tummy and chest help you?
Prevents you from stopping the breath in the chest. And so kind of what my thought is I don't want to feel the chest moving. I want to feel the diaphragm moving. So we're not taking a shallow breath, but a deep breath. And then it really does kind of get you into the zone of trying to not feel, the hairs in your nose move when you're breathing in and out, and almost feel like it's transitionless. So that, in the book, they talked about they would, in the gladiator days, they would know, ancient Chinese soldiers, they would know if they're ready for battle. They put a feather underneath the nose, and if the feather wouldn't move, then the soldier was calm, cool, collected, ready for battle. And the saying of agitated breath equals agitated mind is true. And so it really just helps to keep you centered on that diaphragmatic breathing and kind of just get in the zone of being nice and calm.
So I find that all patients probably have a favorite of these different types of reduced breathing. So that was an example of one, the hand on the tummy and chest. We're going to do 2 more types. So the next one is let's do cupping. Okay. I like that one next. Yeah. So basically all you're going to do is create a seal, like a cup with your hands around your nose and your mouth. So we're trusting though that he's not breathing through his mouth, right? So this is not necessarily a good one for kids, because kids are like, oh, I'm doing it, and sometimes they're not. So we want to make sure that you have a seal so that you can actually feel that breath. So this is really like the masks are actually, this is what masks are basically doing. And if you weren't talking and you were able to focus on your breathing, the mask isn't necessarily a terrible thing for this type of exercise where you're trying to really think about your breath and reduce the breathing. So So this is like creating a mask. A lot of the dental field people like this one the most because it's what they're used to the most. We're going to do the same thing where we set a timer for 4 minutes, and we'll do this for 4 minutes.
And again, the point to stress is doing this under direct supervision by a practitioner. And so we're showing these just to illustrate to patients and to people out there the exercises that are available, but we obviously want people to do this under supervision so that not creating any harm or anxiety with these processes.
Yeah, there's also specific exercises that you don't want to do if you have certain ailments. So you definitely want to do it under supervision for sure. Okay, so same thing. We're going to pretend that there's a string pulling us up all the way to the ceiling. We're going to lengthen the distance between our sternum and our navel. We're going to widen the distance between our ribs. And we're going to focus on that breath coming in and out. So this is the one that I feel like is easiest to imagine a feather, because you can feel how crazy your breath is on your hand, or how smooth and calm it is, and feeling it go into your hand is a really good way to check it. So we're going to walk through the same exact scenario again. You're going to take a normal breath in and a normal breath out the whole time. And then we're going to start to reduce the breathing. So when you first start one of these, just breathe normally, because you're already going to feel like the breath is reduced by adding something to it. So breathing normally in and out through the nose and feeling that breath come in and out. And really focus on that air. At this point, because he's been breathing for a while in his hand, he's probably going to feel that the air is moist or warm going in and out, because the cupping creates warmth in the air that's coming in and out. So you're going to breathe in and out through the nose, and you're going to start to reduce that breath. So I want you to breathe in now less than what you did before. Really focus on that breath. Try not to move the tiny hairs in the nose as the breath is coming in and out. Feel the breath go all the way down to the diaphragm. And then as you exhale, make sure that you're relaxed into that exhale and don't force it out. And as you get to the end of the exhale, have a natural pause before the next breath. Make sure you're sitting up nice and straight, like there's a string pulling you upward. Make sure we're lengthening the distance between the navel and the sternum, widening the distance between the ribs. Focusing on a tolerable air hunger. So I want you to reduce the breath if you can, reduce it even more than what you had before. Focusing on that air going in through the nose all the way down to the diaphragm. Slowly and smoothly. And as you get to the end of that breath in, relax breath out. There should be a natural pause after the breath out before the next breath comes in. Okay. So what do you feel like the difference is between that and the other one?
That's a lot harder.
It is a lot harder. Yeah.
Because you're kind of trapping that air in, and then you feel the moisture of the breath. And it's a little more, it's just more challenging.
Yeah.
It always has been for me.
Yeah. And therefore, I mean, wearing a mask can be challenging, right?
Yeah.
Because I mean, you really are breathing in some really hard stuff. So we're going to get to the next one. The next one is finger blocking. So we're going to block one of the nostrils. So it doesn't matter to me which one. I always tell the patient they can pick. Usually my patients will pick by like checking their nostrils and seeing which one is least congested, and that's the one they like to go with. But if you want a real challenge, go with the one that's most congested, because what we're going to do is we're now taking, people that breathe through their mouth, it's like, drinking through a big gulp straw, and now we're taking that same breath and we're asking you to do like a coffee straw. So breathing through the nostril is much more restrictive, and it is more difficult. So breathing through one nostril alone is already reducing your breath, but then I'm going to ask him to reduce his breath even more doing so. So we'll do the same thing. So, yep. So again, we're going to set up nice and straight. Pretend like a string is pulling us completely up. And then we're going to lengthen the distance between our navel and our sternum. We're going to widen the distance between our ribs. And we're going to make sure that that breath is coming in all the way down to the diaphragm, and that the breath out is a relaxed breath out. It kind of falls out. You're not pushing in any way. And there should be a natural pause at the end of that breath before the next breath is taken in. Now that we're doing a nose blocking, it's really easy to focus on those nose hairs. So really focus on trying not to allow the nose hairs to move as that breath is coming in and out. Like not moving like a feather. And this time when you breathe, I want you to breathe in a little bit less than what you breathed in before. Going all the way down to the diaphragm. And a relaxed breath out. And a natural pause at the end of that breath. And then another breath in when you're ready. And we're going to make sure our posture is good. So sitting up nice and straight. We're lengthening those distances between the navel and the sternum. We're widening the distance between the ribs. We're breathing very slowly, very focused on the breath, smooth breath, quiet breath, slow breath, creating air hunger. You should feel like you want to take more air in. Yeah, you can switch. So he's going to switch halfway through. Ideally, you would do it for 4 minutes each side, but we're going to switch halfway through. So then you would basically, once you switch to the other nostril, you would start all over because this nostril isn't used to that reduced breathing yet. So again, you're going to get your posture correct. You're going to sit up nice and straight. You're going to let your diaphragm have all the room it needs to get that breath all the way down, widening those ribs. And you're going to slow that breath down. You should feel air hunger as you're breathing in and out of the nose naturally. So if you're reducing the breathing on top of that, you're definitely going to feel some air hunger, and that would be normal. First breath out. Do you recommend doing them all before bed? It depends on the patient as far as how often we want to do them, but real breath work is at least 60 minutes a day that you're focused on your breathing. So typically you can spread it out. Doing 5 minutes here or 5 minutes there isn't going to do a huge difference, but if you can spread it out, 20 minutes here, 20 minutes there, that's fine. But yeah, about 60 minutes a day, and it can take 60 to 90 days to change a breathing habit. So that's an hour every single day for 60 to 90 days. And if you wanted to get really extreme with it, you could do it definitely more than that. So it would depend on also what the patient goals are. So how quickly do they need to get to a control pause of 40? Are they running a marathon? Are they doing something that they're training for and they only have this much time? that would mean they would need to increase their practicing of it. So just depends on the patient goals and what they want out of treatment too.
And it does take time. I mean, I've always ran a decent amount and used to breathe through my mouth the entire run. And now I can go, 10, 14 miles purely breathing through the nose. It is more challenging if you're running with someone and you're talking. But if you're by yourself, you should be able to run miles on miles without breathing through the mouth.
And then the other question was, what do you do if the patient still has nasal congestion? Do you offer Kleenex or a nasal spray while they are working through this exercise?
Yeah, so in the office, we, of course, when we're working with patients, it's very customized. And, we have all these exercises and we kind of pick what's best for the situation. We have Kleenex, a hand sanitizer, and nasal decongestant sprays. If a patient can't even get past some of the first, a controlled pause that's really, really low, or the nose unblocking is not quite doing it. But you'd be surprised if you do it 6 times in a row, that nose unblocking exercise, you'll need Kleenex a lot of times because it'll start to decongest the nose quite profoundly. And, it's something you can even do, in a shower in the morning where you have some steam that'll help to decongest the nose even further. So when patients do it, they're always pleasantly surprised with how well that decongests the nose.
And don't be surprised if you need a Kleenex afterwards. If you need to blow your nose, that's a good thing. It's actually getting some of that stuff out of there. So a lot of my patients do need to blow their nose after the exercise because it did clear up so much stuff. But it won't dissolve mucus. Like if you have mucus in there, it's got to come out some way. They could use a Kleenex for that. But ultimately, if you aren't getting anywhere with these exercises, then that would definitely be a referral for an ENT to take a look to see if there's something else going on.
And for those of you that exercise, you'll find if you're running outside or something, you'll need to blow your nose mid-run because you're utilizing and you're requiring more air, so that nose will naturally decongest when you get into a sympathetic state, that fight or flight response. And that's precisely what we're doing with the nose unblocking exercise, is we're creating a sympathetic state in the nose where we are requiring more air, so that nose will in fact decongest. So we wanted to take the exercises up to about an hour and then be available to answer any questions, whether people have them live or some that came in on the side. So I think we answered a few on the fly. I'm just trying to read from here. The one Crystal answered about how much, the more you practice it, the better you'll get at it, and you'll get more benefit out of it. Especially with the kids, breaking it up is probably the easiest. Mm-hmm. We did it this past year in a first grade classroom, and we did 30-minute segments where we did 10 minutes of explaining, 10 minutes of instruction, and then 10 minutes of practicing. And that worked out pretty well for the kids. And then the teacher could then implement those exercises into the classroom when walking to the restroom, keeping the lips closed, during certain parts of school when people are presenting or going to church, things like that. Just really focusing on those kids keeping the lips closed.
I think too, it's very important to do this sometimes in a group session more than individual, because when all eyes are on you, it feels you get more anxious about a lot of the breath work. So ideally doing it in a group setting is better, just so that you're not having to focus your attention on one person as someone teaching them, and then not one person feels you staring at them, because breathing is it's natural, and when somebody's asking you to change it, it can be very unnatural.
I felt a lot of pressure.
I'm sure.
Next question: how many total exercises do we do? Well, it really depends on the patient, and so we'll have patients. Typically, we try to get a patient to master and do 1 to 3 things at a time in between appointments, so we're not overwhelming them. But there's well over 15 different exercises depending on what we're trying to accomplish and what we want to improve upon.
I think the most important thing to remember with all of this therapy, myofunctional therapy and breathing retraining, is that the end goal is that you habituate the good practices that we've implemented, and so naturally, a year after doing therapy, hopefully you don't have to do the exercises at all, because you're naturally breathing well and you're naturally, holding your lips together, and all the things that the exercises are training you to do is so that you can habituate doing that in your everyday life. So that would be ultimately the goal of anything that we're trying to do.
And the nose is the first line defense of our immune system. So it's, just like, the importance of wearing a mask in a dental setting when we have splatter coming at us and such. If we are breathing through our mouth, we just, in effect, decreased our immunity because we're not having a chance to filter that air before it gets into our lungs. And that's why we know that mouth breathers have a greater incidence of asthma and agitated breath, congestion, and stuff like that. So really the key is making it a habit and really focusing on that breath, because you'd be surprised how much can be improved through some directed exercises and really compliance. So it takes compliance, it takes time. And just like biking or running or anything like that, you gotta finish a mile before you go to 2, before you go to 3, before you go to 4. So don't be hard on yourself if that control pause is really, really short on the front end. We kind of have a goal to work towards. And one thing that's easy to do with the kids is there's a steps exercise that you do that breath hold as you're counting steps. And so that's a nice way to have kids distracted or go in a circle, and they kind of have a number they can achieve. Mm-hmm. And so we can have kids, in the front lawn doing it kind of as a game against each other to see who can walk the furthest with holding their breath. And the key is, the moment you let go of your nose is to resume nasal breathing and keep those lips closed the whole time. And so what the kids will work with, we will put tape over their lips, like Crystal said, just to help remind them not to breathe through their mouth during the exercises.
Yeah, or just have them hold an item between their lips. So just holding something between your lips will actually help you keep your lips together too, because you're holding it. And when you were talking about asthma, I thought like Patrick McEwen, the person that taught us, cured himself basically of his asthma that he had had for a long time because he retrained his breathing. So lots of things can improve and things are possible, but obviously he took a lot of time and dedication and retrained his breathing. So habitually, actually when he taught us, he had to take breaks, no talk breaks, so that he could actually get a hold of his breath and practice what he was preaching. So it takes time, but.
And the nice part about these is it's very low risk. So we're not permanently doing a procedure or undoing something, because ultimately a patient can always open their mouth, breathe, and they're in complete control of everything that's happening. And we want to push people and make it slightly uncomfortable. We're not asking people to deprive themselves to where they turn blue. And so that's where the education piece and the guidance of it is really important. If it was as simple as publishing exercises and distributing them across, we would do that, but it won't work as effectively. So these are all best under direction, but doing it in a group setting is super helpful. Get more camaraderie and compliance and less pressure focused directly on you.
And with kids, competition, which is more fun for them because they're used to that.
But you got to watch those first graders, because they'll try to cheat here and there and open their mouth without trying to hide it behind there. So if we don't have any other questions, that kind of wraps it up for tonight. We just wanted to provide some content. I know when I started learning this, I heard about it, and like we had to go to a course just to get an idea of what you mean by breath work or exercises and stuff. So we wanted to just kind of sprinkle out there some of what it is, what it looks like, feels like, and kind of show how easy in one sense, but safe it is as well. Can we get the 15 exercises? So I have to look. If you look up Buteyko breathing, you can find all the exercises. But really, the importance is knowing when to do it. So we can direct you guys. We'll send a link out with some information on those exercises. We obviously have to be cognizant of copyright things with Buteyko breathing with Patrick McEwen and such. So anything that we can legally, ethically pass out, be more than happy to share it with you. My team will just have to check on a few of those things. But probably the one best thing people can do and I have no affiliation with this book other than I thought it was good and had my team read it. There's a lot of good books. Patrick McEwen has a great book called The Oxygen Advantage. That's more directed towards sports. But if you read The Oxygen Advantage, you read Breath and a couple other books out there, you'll hear a lot of the same stuff and citing a lot of the same literature over and over, which is good because it just adds to the validity of it.
So just curious, what do you have your kids do before bed?
Oh, my kids.
Well,
It depends on the night. But we will do some breath work while we're reading a story or saying prayers and stuff. So yesterday in the bath, I had my daughter do nose unblocking exercise. They're both, the two older ones are in ortho. But the kind of the funniest part is if we're reading a bedtime story, we'll hear our 6-year-old yell at the 4-year-old, Nicholas, close your mouth. You're supposed to breathe through your nose. And I kind of like hearing that because they get the importance of it and they see it. Definitely when they're agitated or if they have congestion, we do more and more of it. But the reality is it's really hard. I mean, a bedtime routine, it's tough enough sometimes to brush the teeth and go to the bathroom. So adding in a bunch of breath work is tough. But what we have had success with is the two older kids at 7 and 6, just sitting them down and having them do their exercises before they go to bed, working on that diaphragmatic breathing, and then setting the Alexa timer or a timer and having them do the decongested nose before bed. But if I had to pick one to do before bed, it's probably that nose unblocking, decongested nose exercise.
I think.
What's the author of Breath?
Answering for you.
Oh, perfect. Yeah, James Nestor.
I think when we worked with the first graders, they appreciated all the exercises. They thought it was fun, and it was easy for them to do, and it was easy for them to explain, and they remembered it. So, a first grader can do it, and the teachers loved it because they were very quiet. So
Yeah.
Story time is a great time to practice breath
If you
work.
want 20 minutes of silence before bed, have them close their lips and work on nasal breathing. So, any questions you have, feel free to reach out to us, add some comments on the Facebook page or send messages in. And then also, as we do these again, if there's specific things you want us to address, our goal is to put out quality information that helps promote healthy living, healthy lifestyle, and gets people feeling better overall. And if we can be a resource and a conduit to that, we feel like we've done our job. So thanks, Crystal, for your time and your expertise, and we'll let you get back to your new little baby.
Thanks. Thank you, guys.
All right. Thanks, everyone.
See ya.